you so much. Aaron, and esteemed colleagues and audience, healthcare is undoubtedly at an inflection point right now. The internal and external pressures that are hitting our system are extraordinary and are unprecedented. We just spent effectively the better part of the day up until now hearing about cyber risk and the escalating realities that are apparent and real. We also have workforce fatigue. We have constrained reimbursement. We have exploding patient expectations. We also have emerging AI and technology capabilities like we have never had before. We're in the early innings. We're at the beginning of this new century. At the Digital Health Institute for Transformation, we like to say we're in 1926 in the 21st century for context, okay? The only problem is it took 100 years for last century to transform. It's likely only going to take 10 more years here for this century to transform, right? Healthcare leaders, particularly CTOs and CIOs of healthcare systems, are changing the conversation from a technology conversation to an operating model conversation. It's not about managing systems anymore. It's about architecting transformation. It's moving upstream to be more offensive than just defensive, right? And it's changing culture. It's putting people in the driver's seat. So I know that that's very strategic and ambiguous in some respect as it relates to, well, what does that mean for our reality today? And that's why I'm excited to have Aaron join this conversation and give real context of what a day in the life looks like for a healthcare system executive that's living this real world reality of these pressures. So Aaron, starting with perhaps your vantage point, your point of view, you have these realities hitting you every day. Yet you know that the opportunity for transformation is also today, and that the window of that opportunity is not decades, but years.
Correct.
How do you lead?
Well, I think what we'll do first is I'll get the doom and gloom out of the way, and I'll talk a little bit about the headwinds. I think we have all heard a little bit of that from the cyber side of the world and some of the uncertainty that poses for us. But let's think about the entire picture of the American healthcare system and look at it a little bit from the health system lens. We're in a place where legislatively we've seen huge changes that are going to be coming down the road from a government reimbursement standpoint that are going to be major headwinds. We see from the payer side, they're already rapidly deploying AI. And no offense to any of my payer friends in the room, but the major aim of that is for them to try to erode how much claims reimbursement that they have to give us. So we have pressure on both sides of the coin as it relates to reimbursement. The second aspect is we're in a clinician shortage. We're not minting enough new clinicians, right? Couple that with unprecedented demand. We have an unprecedented demand for healthcare services from more complex patients and populations that we're being asked to do. And then think about sort of the fixed cost structure that we ran into during COVID, whether it was supply chain or it was labor, and we were told that was temporary. No, it wasn't. So the fixed cost structure remains an extremely high and growing year over year. So margin erosion and all of these things that occur from that. And then coupling that with increased patient expectations. for a better experience, to have that Amazon, I just get to push a button sort of thing. They want it to be like how they book their vacations, how they buy their things off of TV or off of their phones. They want it to be simple, and they want it to be consumer friendly. So we're dealing with all of those things, to your point. But Michael, I think what you brought up that I want the group to know is, now that the doom and gloom's sort of out of the way, we want to talk a little bit, I think, about how special this tool set is that we have, and how it's unprecedented in our industry, and how that can radically transform change. So I don't know, Michael, one of the other things we didn't really touch on that I think it's important to set the stage as well is some of the market disruptors that we're seeing in this space. So do you want to take a couple seconds to talk about that?
Well, absolutely. And, as a healthcare system, you have an impending existential threat in the Amazons, let's say the Oura Rings, the Whoops, the Googles, that are gaining trust in the consumer world, where our biometric data, our, let's call it upstream drivers of health, the data that does not sit in the healthcare system on a day-to-day basis, it sits in consumer tech. Consumer health tech, and these organizations are becoming much more powerful and robust in their product and system architecture, such that if I'm a healthcare system and I'm painting a path into the future, let's say 5 to 10 years from now, my competitor is not the health system down the street. It's Oura, the ring manufacturer, that has just cobbled together a provider network, an acute care system acquisition strategy, and now owns and manages my experience, right? And so as a healthcare system, if I'm not thinking about health as an experience center, and I'm thinking about health as a sick care center, I've already lost. I'm just waiting for the end of the day to go home and cash in my chips. But if you're a healthcare system that is leaning forward like Aaron's is, and understanding the capabilities and getting the bias and the prejudice of the history off of my thinking, and imagining what life could be like if I'm delighting my patients and my workforce with a brand new set of journeys and experiences, then the opportunity and the possibility of survival leading to competitive relevance is there. But it does take a mind shift. You have to get out of the old and start to jump into the new.
That's correct. So I think, one of the things that we need to talk about is how quickly this is moving. You've heard a lot of that today. So what I want to share with you is kind of what does the next 12 to 24 months look like, and then we can kind of look at a broader horizon. I was having a great conversation with Simon here about what he's done in another industry. What we see in healthcare today isn't so much generally an AI revolution, which there is on the clinician side of this, and unburdening their documentation needs or their ability to chart, et cetera. We see a lot of really great things there. What we're really seeing is a lot of low-hanging fruit in this being an agentic revolution. Healthcare, like government systems or some of these other areas, is wrought with a lot of human in the loop, human touching this. It's a lot of high burden, high work with, quite frankly, a lot of opportunity for human error, that we see opportunities to automate across the board. And so we see, as I was mentioning some of the headwinds, we look at those as opportunities now. So for our physicians and our care teams, how can we unburden the care team and make that process easier for them so that they can see more patients? We can create more capacity, we can create more utilization with the same store, the same footprint of providers, because that pool isn't getting any bigger. When we talk about access and flow, when we talk about our patients wanting to be able to book their own appointment, or we talk about how they get their referral and then book their next appointment with a specialist or imaging or other diagnostic activities that have to happen in their complex care episodes, that can be automated and it can be more seamless for them. Again, creating more throughput and more capacity with the same store and with the same process, and the patient having a better time as they're doing it, having a better outcome and a better experience as they do that. We're seeing huge gains in revenue cycle. We are going to battle with the payers too, and being able to show that we can play that game too, but also how it helps our patients. Pay your bill, do those easy things that they need to do, and doing it in an automated fashion. And then I think the last one that we have to just be honest with ourselves about is what this is going to mean for workforce modernization. We just have to be honest about what that means and how we look to the workforce of the future. And we look to, and it's not just about reducing headcount and things of that nature, which I think the conversation gets stagnated in that space. It's about how do we upskill? How do we teach our staff to, instead of managing a staff of people, maybe they're managing a staff of agents.
Right.
There's a lot of opportunities to discuss that. So Mike, I know that you have talked a little bit about the transformation muscle.
That's right.
Can you tell the group a little about that?
I mean, you know, what we're talking about is, and you've mentioned this in your previous panel, which is the democratization of agency and urgency. What does that really mean? As leaders, we have an incredible responsibility to create the environment, the experience of our people to learn fast, to fail quickly, and to grow continuously. What does that mean? It means that the building of a muscle doesn't happen overnight. It happens over time, right? And so making practice a process that is invested in and invested over and over again in is the driver of transformation. It's your ability as an organization from the center to the edge to be curious, right? To test and implement and try and evaluate your practice like you would if you went to a gym. You're not going to go to a gym if you've never gone to a gym before and use all the equipment in the gym. No. You got to pick one piece of equipment to get good at, to get confident in. Then you might go to the second piece of equipment. And then over time, you're going to the gym every day. And then all of a sudden, your body and your health is transformed. Well, that's digital transformation. We can't let AI sit within the CTO organization or the CIO organization or within Aaron's organization. It might start there as a framework to govern and manage and protect the ups and downs as it relates to the investment immediately, but if it doesn't make it down to the front desk staff, to the nursing staff, to the parking attendants, if they're not part of the transformation, you will not transform, okay? And so at DHIT, we have a program called the Health Innovation Sprint, which is effectively a operating model that has 4 stages: discover, define, design, and deliver. And the idea is that every member of the organization is part of this process in micro groups. Think of it as a collaborative muscle, a competency building muscle. And the idea is that pain is shared by all of us, right? And so all of us should be urgently trying to understand the pain in a collaborative manner and apply every resource, every technology, every meaningful advantage we can as a team to execute on solving that problem. And we should try, and we should learn, and we should adapt, and do it over and over and over again. That's the process of digital transformation. It's not implementing a technology. It's getting so good that you're implementing technologies and you're killing them as fast as you are brushing your teeth, going to the bathroom, because those are habits that are formed over time. So culture transformation is digital transformation, right? And it's our responsibility as leaders to go from the center to the edge, back to the center, like a beating heart, expanding, collapsing, expanding, collapsing.
Yeah, and I think it's an incredibly important point, and I said this in the earlier talk, so I apologize, but I'm going to keep beating this drum, is the workforce of the future is really going to come down to, again, in the next 12 to 36 months, especially in our industry, is going to come down to workforce reevaluation and upskilling and clear communications to these folks. It's going to come down to democratizing our AI tools. Yes, still governing. Yes, still having an approach and guardrails in place for agentic development or orchestration or otherwise. But again, getting those tools in the hands of our frontline folks. Imagine deploying the ability for 20,000 people to build 20,000 agents to solve 20,000 problems. What used to take us years to change a workflow, or to change a documentation practice, or to change a care seamlessness or care pathway handoff, being solved like that from frontline folks that do it every day, and then harvesting those best ideas out of that workforce and scaling it across our enterprise. That is the true magic that comes with some of the revolution that's going to occur. But I think to your point, Michael, and what I've seen in discussions that you and I have had, but then discussions we've had with other industry leaders, is that there is that real fear and apprehension in the workforce about what this means, and you can't let that vacuum exist.
That's right.
You have to communicate. You have to have upskilling opportunities. You have to have clear curricula that is designed for these various different cohorts of folks, whether it's frontline staff or your executive leaders, up to and including the tracks for your clinician staff. You need to make sure that that's an important part of your innovation plan.
100%, and it's effectively, as someone mentioned it earlier, I don't remember the panel or the name, but it's flipping the model, right? You're taking a enterprise, a system, a society from what used to be institutions, departments, and encounters. That's what health systems and healthcare has historically been. Siloed, broken up into expertise, transacted upon individually in a one-to-one basis, to flat, agile, liquid, continuous, all over the place, invisible. That's the transformation at hand. And so this is what we're going through, and we're at we were talking early innings, and then we started laughing, we might be in preseason here. We're not even in the game yet, because we're just beginning to unlock what it means to deliver care in the 21st century. It's 1926 in the 21st century. Right? If we don't think like that, we're not going to win and delight the way we could. And you might not exist in 2035. So I, implore all of us to wake up every day understanding that if we want to delight and deliver, it requires a flip on its axis of how you approach and how you attack. Certainly have to be defensive to risk and honor the realities of the threats out there, but that doesn't mean don't be bullish on change and don't be bullish on accelerating the implementation and the experimentation cycles. I want to just quickly jump to back to bureaucracy and the flipping of bureaucracy and perhaps what agentic orchestration could lead us. I brought up the Spotify example of how they would use democratized innovation engine to autonomously deploy innovation at scale. You want to just talk a little bit about like that from a healthcare perspective in terms of how you're thinking about it at Inova?
Yeah, absolutely. I mean, I think, agentic approach to AI is one of the most exciting portions of this field. And I think what we're seeing especially is, one, we are wanting to democratize this to the individual so that the individual can be more productive. They can summarize their meetings. If they were out on vacation for a week, it can say, give me all my emails and things that I need to know. Their own sort of, virtual chief of staff, that sort of thing. So individual empowerment. But I think what we're also seeing from a democratized area is, let's say we have a person that's a referral coordinator and they're working in a, complex MSK space. And they're saying, gosh, we have such a problem of knitting together the referral from primary care for hip pain to our MSK physician to then go to get their imaging done, to then go get their surgery completed at an ASC, and then, go get post-surgical rehab done and meet with their PT, and being able to deploy waterfall agents to help guide that patient through every aspect of that journey. That's what creates seamlessness. And if that idea comes from the field, and we get that democratized idea from the field, and we got it from one area in our MSK department, imagine how that could scale across all of our surgical disciplines. And so what we see is it being a groundswell or a wellspring of great ideas that we're going to be able to scale across our enterprise. So it's going to be transformational. And I would double click into what Michael said about what patients are expecting. I look out at this ballroom, I don't just see wonderful healthcare professionals, I see patients. And guess what we all want? We want what they want in the future. They want to use their wearables. They want to push information to their doctor to review, or get their medication renewed, or get whatever, their appointment scheduled. They don't want to go in. They want to be able to do this through empowering themselves with technology. And so I do think we have to be prepared for that consumer and patient of the future, because I'm looking at all of them here in this room, including the two of us sitting here. So it's an important opportunity that we keep that in mind, but I think it's a huge opportunity for us as we go forward.
Absolutely. I just, speaking about the future a little bit, and let me stretch it out for context. There are clinical trials right now being run that are focused on age reversal technologies that optimize genetic profiling or genetic mitigation in protein and gene expression for aging. And what that means in a nutshell is that they believe, these leaders of age reversal technologies, that if we live healthy in the next 10 years, well, then we're going to be living till 160 to 200. Okay? Which is hard for us to think about, because wow, that's a lot older than 80 to 90 years old that we currently live to. But guess what? 100 years ago, we weren't living to 80 to 90, right? And so we see this growth and this maturity of being able to extend our life and extend our health. And that means greater pressure for our healthcare system. Greater pressure to get on the front end of our health to help us age well and age long through the experiences that we deliver. Thus, being a sick care system is not the answer anymore. Being a health system is. And that's why being democratized to innovation and hungry for data that is not in the system, that's part of your environment, socioeconomics, your behavior, your genetic, biological data. This is forming the new representation of our patient, which is our citizen, our community, our parents, ourselves, etc. So we have to look and think differently. I don't know, Aaron, when we think about kind of takeaways as a system leader at Inova, what would you imagine, the best kind of key takeaways to distill, if you could resonate with these great people for many, many months to come, what would Aaron be saying 3 months from now that you hope the message would resonate still with?
Well, Michael, I would say what I say to my staff, who, again, I have a member of my staff here in the audience, that what a cool time in history that we're here. This is incredible. We're going to lead the revolution. We're going to lead to the biggest sea change in healthcare that's ever occurred. And we're going to do it much more rapidly than the assembly line in the Model T.
Indeed.
It's going to happen, it's going to change daily, it's going to change monthly. What I would want to leave the room with is that there's some key tenets that I again want to reiterate, especially with some of my clinical colleagues here, because they impress this upon me constantly. We're going to approach this with a culture of safety, okay? Everything that we do, every decision we make, every model we evaluate, every agent we design, we're going to do so with the patient in mind. We're going to do so with safety in mind, because these are our people in our community. And that is our sacred charge, is to do that first. The second is that we want to make this better. We want things to be easier. We want them to be more seamless. We want this to be a better experience. That's what we all strive for. Folks like myself and like Zeeshan, we're support and gear for incredible people that are performing transplants each day, that are doing heart surgery, that are delivering the children into our community, that are doing unbelievable stuff. And we want to make the physician's life easier. We want to make the nurse at the bedside's job easier. And we want to be able to take care of our community. That's got to be the foremost mindset that we have as we approach this. Secondly, we have to wield this technology in a way that is organized and orchestrated, because there's a lot of, right now, there's a lot of noise. There's a lot of, as I called them a little earlier, we're kind of in the bright, shiny object phase. And I think we have to be careful of that. So what I would advise everybody, govern and govern early. Whatever that process looks like, however small or however a couple people in a room meeting once a week, do it. Govern, govern, govern. Have portfolio discipline. I mean, Michael, you and I talked about you can spend yourself into oblivion doing this. So make sure you have portfolio discipline. Make sure that every initiative and every model or every vendor that you're considering, make sure that ties into the strategic imperatives of your health system or what you're trying to accomplish. And then training. Training is super important in upskilling and communication. We've talked about that and what happens in the absence of that. It won't be utilized. There will be fear. There will be a misunderstanding of the approach. So making sure that there's a comprehensive training approach and a communication approach that underpins your program and carries your program is hugely important. ROI and return of value. Everything is not going to be in dollars. So understanding what a true value story is for ROI or return on value for these initiatives is a language we need to start to speak, because it's going to be hard to quantify in some ways. But we're going to get to a place where we can tell those stories intelligently, and we can show the value and yield of this work in these programs. And then I'll say the D word one more time, democratize. I truly believe that getting these tools in the hands of our frontline operators and clinicians and business professionals is where the wellspring of these great ideas that are going to change our business are going to come from.
Yeah, that's well said. I'll summarize perhaps in three strong words: agency with urgency, anchored to intention. Right? That's what you have to live with and by to be successful in time and over time.